All right, so Luca, if you had a QL strain, what I do is first just check range of motion in your lower lumbar spine and the hips, just to see if there's any hypo or hypermobility between those. If there was a hypermobility in the lower lumbar spine, and just do PAs on the transverse processes. So I'd most likely do about a grade 2 to grade 3. So if we were to do a grade 3, I would do PA on the transverse processes, 2 to 3 oscillations per second, and I do that for about 30 seconds on, 30 seconds off with about 4 to 5 sets. And then just trying to check any spasming of the erector spinae or QL, so maybe do a light sports massage, which would consist of light effleurage, deep effleurage, tapement, then back to deep and light. So that would probably last about 2 to 3 minutes, depending how you respond to the massage. And then I'd also just check pelvic levels before and after. And then I'd also just do like a slight wrap around the QL and the erector spinae with tensoplast, just to try and bring the 2 points of the QL together so they're not being separated as you're doing your sport. And then I'd also just do some sport-specific activities to see if you're actually ready. So just having like a dowel kind of like this, and just doing, like this would be bigger, and going in and out like you would do in kayaking, and see if there's any pain with that. And then if you had a heel contusion for while you're playing basketball, again, I'd just try and assess range of motion of the ankle. I tape. For every tape job, I check pulse motor sensation before and after. So I just do a heel pad tape drop, so just on the bottom of the calcaneus, kind of pushing the muscle and the fat together, so you kind of have like a pad underneath there to give you more cushioning. And then I'd also potentially wrap like a pad or donut around the heel, just to give extra support while you're playing basketball. And just really focused on sport-specific activities, so really focusing on cutting, fast agility drills, and shooting, and see if that actually affects anything. And then lastly, for a contusion of the posterior forearm, I would first just assess range of motion again, so I check flexion extension, ulnar deviation, radial deviation, and then I do light milking massage, just making sure there's no swelling or inflammation in the area. There might be a little bit of swelling, so with that milking massage, we try and move that away from the initial site toward your closer to the body. And then I'd also just make a donut as well, or a pad, and put it where the contusion was, and then wrap it with tensoplast, and then see how that felt while you're doing some sports activities as well. So just playing lacrosse at 25-50 with no contact, and then eventually going into a little bit of contact, and then seeing how you felt going at 100% throws, catching, receiving hits, and just making sure that you're actually confident going back in. Because with some of those injuries, like having contusion, people become really hesitant with going back into play with an injury like that. So just making sure you feel 100% ready, and that the tape job doesn't actually restrict you from anything, and you don't feel hesitant going into contact, which is a big part of being a lacrosse player.